Okay, so this is a video on trach care. I had to improvise. I don't have a trach and I do not have a trach kit, so I kind of put this together. I use the Easy Pap. It kind of looks like a trach. So anyway, if this falls apart, don't fret. We're just going to go through the procedures. Anyway, so this is a sterile procedure. You always have to stay sterile. If you have to change your gloves in the middle of the procedure, you have to do it, but you always stay sterile. Connect the oxygen from the trach. We would, if you really want to make sure you have everything ready, the kit and everything ready, so that the patient isn't off the oxygen for too long. If you don't come prepared and you have to put things together, then you want to put a face mask on here and keep them oxygenated while you're going through the procedure. The first thing you want to do is suction the patient. So you would disconnect the tubing. You want to use the catheter. You lube up the catheter, kind of like we did with the nasotracheal. You're going to use that catheter, lube it up, go down into the trach, and then when the patient coughs or you feel resistance, and you pull back a little bit, and then you suction out for 10 to 15 seconds. Once you're done doing the suctioning, then you're going to change the dressing. You want to take out the inner cannula first, toss it and replace it with a new one. Then what you do is again, this may fall apart, I don't know, but I'm going to try. You want to remove the dressing. So we take this out. Yeah, it's going to fall apart. So we take this out. You always want to make sure that you're keeping the trach stable, and so that there's no issues with the trach itself. So you remove that, and then you're going to take swabs, okay, and you use like a saline and peroxide mixture, and you clean around the trach with the swabs from here out. You toss it, get another one, from here out, toss it, get another one, and you go all around the trach. Once you clean the area, then you're going to change the dressing and the ties as well, and the kit should have that stuff in it. And then you're going to basically just replace the dressing. Again, I'm trying to keep this thing from falling apart, so I'm sorry. And then once you replace the dressing, you're going to hook up the oxygen, the tubing back, the ventilator back to the trach, and then you're going to reassess the patient, get the vital signs, and you're supposed to do that before we do the procedure as well, before and after the procedure. You're going to assess the patient, get the breath sounds, get the vital signs, check the SpO2, and make sure that the patient is stable and capable of actually, so that you're able to do the procedure. And that's pretty much it.